Well, hello everyone. Thank you so much for joining wherever you're joining from today. If you guys hear a little congestion, it is summer right now for me and I have a little summer cold. But that's not going to keep me away from this interview because my intuition told me I had to just keep doing it. So we'll get to all that. But if you're just joining me and wondering who is this person chatting, I'm Ashley Koff. I'm a registered dietitian and I'm CEO of the Better Nutrition Program. And at the Better Nutrition Program, we provide practitioner-developed better nutrition assessment tools for practitioners like dietitians, health coaches, doctors, and you, their patients, so that you make sure that you're assessing your total nutrition. You're turning on those location settings. You know where you are today so that you can figure out a better way, your better way to get where you want to go. And we are thrilled. This series, brought to you by the Better Nutrition Program, is the Better Nutrition Expert Interviews. And I always like to start with what is an expert, because I feel like today we've got a lot of different information out there, and sometimes we're not always using words in the same way. So here, I'm using the word expert as somebody who has experience with the science, has reviewed the science, explored the science, and then also puts it into practice. And so that's going to be where you get that combination of science plus human, and we put it together and we have an expert. So tonight, if you have any questions for our guest, please go ahead and ask them if you're joining us live. And if you are not joining us live and you still have a question for our guest, go ahead and put that in the comment section. At any point, just let us know where you're joining from, and what you think of the interview. And I will make sure that all of that information, and especially your questions, gets over to our guest. So without further ado, I was just telling Dainna that I had like a little bit of goosebumps and a little, there's so much of this that is happening at the right time and in the country and the right time in the world for this conversation, for me to be able to interview her, because I have a lot of things I wanted to ask her about. But I want to start with your background. You're a functional medicine consultant to musicians, to athletes, to corporations. So tell me about your journey and how you became a health coach, and certainly how you became a health coach to all these elite performers.
Well, thank you so much, Ashley. I'm really happy to be here with you and your audience. I feel like my journey began because of my poor health problems, just like so many other people who got into healthcare, be it doctors, nurses, dietitians, health coaches, everybody. We get into an area because we like to help people, and sometimes we have to help ourselves. So my journey began that way. With a lot of digestive issues and trying to find, all in the gut, trying to find the way to help heal my body, combining my intuition, what felt like this is going to work, this isn't going to work, with some really skilled practitioners. So I found my way to becoming a health coach and doing training there, and then advanced training to really learn about functional medicine, which really combines so much about health coaching, but then the biochemistry of the body. And I've been in love with it ever since. I've been doing it since 2011. And the reason I suppose I became somebody who works with musicians is because my husband's a musician. And he kept saying to me, babe, do you think you can work with this person? Do you think you could just talk to them? And here it is, 100 years later, and I have a lot of great clients who I work with. I have a staff of other health coaches and functional medicine practitioners who work with us because people are starting to realize, wow, I could really work with a health coach and I could turn things around.
Mm-hmm. You got a little giggle from me because people either know my story or they can read about it. But my low moment, I was actually working in advertising, and my low moment was a 7-day goat's milk only cleanse because somebody had diagnosed me as having a worm in my gut without any information, and I thought this was going to make me better. So, desperation breeds desperate efforts, right? And I think, one of the things you and I were talking about is your passion for helping people harness their intuition. And I said, yeah, but you got to have a healthy digestion to be able to be in touch with your intuition. So tell us a little bit about harnessing your intuition.
Well, so what I try to do is really convey to anybody that we work with that we are not gods. We are not the people who are even in charge. We have all of the expert advice, and we've been doing it, but you live in your body, and there is no substitute for the fact that you know what your life experiences have been like. Um, when I eat this, I feel that way. And there is just no substitute for that firsthand knowledge and observation and just living and being able to connect with us in a way that is impactful and in a way that helps you dissect things. But we puzzle piece together, right? But like I said, we want people to be able to harness the intuition and the skills that they absolutely have. Every human has it. I believe that. And then for them to go ahead and live their life happily. It's so funny because my family will hear me talking to prospective clients, and sometimes they'll say to me, Mom, you sound almost like you're trying to discourage them from working with you. And I say, it's not that. It's not that at all. Don't misunderstand. I'm a nice person. I'm kind, and I'm educated, and I'm able to work with people to get good results. But I want them to take it seriously. And I tell them my sincere wish is to push you out of the nest. I want you to learn all the knowledge that you can, and then come back and check with us in a year and see how you're doing. And maybe every year you come and you do check-ins with us just to see how you're doing, see if you need to tweak something. That is graduation day, and we actually treat it like graduation day, and we do like, yay, you graduated, because it's a wonderful thing when people can connect with their bodies and say, okay, I'm going to go and I'm going to get my annual checkup, and I'm going to do all the things that I need to do to feel empowered about my health. But I really am the one leading this because it's me and my body.
Yeah. And, I think I look for silver linings. I always believe that in the silver linings, not only do we find something that we can celebrate or that gives us hope or that gives us direction, but it also it helps to clarify what our path forward is. And the healthcare system is just so broken. It's almost like it is laughable. Like these days, it's not fun when people say we have a disease system, or, all of these different puns on healthcare, that come up. And as somebody who spent the last 4.5, 5 years living in DC, it was pretty profound for me to realize, wow, I'm providing healthcare services to people who are going in to work today and trying to vote to take away my healthcare. I was like, wait a second, So there's a lot of stuff that's broken. There's also some, quite honestly, infighting or confusion. We hear that doctors don't necessarily know anything about nutrition. Well, I find that totally false information and very frustrating as somebody who's the daughter and sibling of doctors and friends of mine as well as doctors, but also just within their scope of practice, what do they prioritize? What do they have available, to do? And then dietitians, health coaches, oftentimes there aren't great relationships between dietitians and health coaches. And so I'm bringing up so there's got to be a silver lining. So the silver lining is, I think in all of this, it's taught us all that we have to be more responsible for our health care and to seek those solutions. But I also think there's another silver lining that I was learning about from you. You go to DC and you just got back from DC. So this is a long way round to take us to where I want to go with this. To help me understand as a health coach and working, as a functional medicine consultant for high performers, that's what I'm deeming you. So what drove you to DC? What got you on the plane to go to DC? And what have you been accomplishing there over the last couple of years?
Well, I want to say two things to what you said, because I think with you and I doing this today, we are taking another step towards the health coach dietitian collaboration.
Yeah.
Right? Because there are more than enough people who need what we are saying. I really don't have any jealousy over, you do what you're doing, and there's more than enough people for you to work with, and there's more than enough people for me to work with. There's 7.7 billion people on the planet. We need a lot of people in this effort. But so that was the first thing. But the second thing really was, the thing that brought me to DC was I was invited. I was asked by a lobbying company who is really getting a lot of practitioners together, a lot of health coaches to go every year to talk about health coaching, because although a lot of people know what health coaching is now and some people don't, the people who are making policy in DC really don't. And I've been going 3 years in a row, and I'm going to go next year again. And what I've seen is every year we make some progress. And every year, what we do is we meet members of Congress, we meet their staff, we have a jam-packed day where we're essentially lobbyists. And we are going and we are educating them in a very small amount of time to make it memorable, to make it impactful, to say there are people who want to be better. And this is one of the ways that you can do it. It's delivering a very simple message, but my heart breaks for people who, like I said, who got into public service, who want to help people, and the system, like you said, is broken. And we know with health coaching, we know with food, we know with what dietitians are working with people to help them learn about their bodies, that there's a lot that can be accomplished with food. So I'm all about doing that. And like I said, I'll come back next year and we can do another interview and I'll be able to tell you a little bit more, because every year when we go now, what we did this past year was we were able to educate them some more. And a few of the people were like, yes, I remember what a health coach is. They're kind of a buddy or a partner to help you dissect things. But now what they're doing, there's a bill that is working its way. It has support in the Senate, but it's working its way through the House, and they're looking for a sponsor to help make sure that flexible spending accounts and health savings accounts are able to use dollars from there to apply towards health coaching. So, because that was the thing too. We know it works, but how do we pay for it?
So take me through, just think of a patient in your head. You don't have to share who the patient is or information about them. But take me through how you would work with them in conjunction also with their other practitioners. So does somebody come to you after they've seen their doctor? Does somebody come to you when they've seen a bunch of doctors? Just give me sort of an example of the work that you've done.
Okay. And I will tell you, thank you for asking that, because you reminded me that I wanted to say I have wonderful partnerships with doctors. I have wonderful partnerships with my local lab. I have wonderful partnerships with the lab in Chicago that one of my clients, I'm New York based, but because of Skype and because of all of the ways that we can connect through Zoom, we have clients all over the world. So we're able to go ahead and partner with their doctors and their nurse practitioners and their physician's assistants to say, what we typically do is a client would show up and they may have a bunch of lab work that they have from their annual physical. But maybe there's some gaps. Maybe there's some other things that we want to see what's in there. And I would send a letter to their healthcare practitioner respectfully saying, you and I have a patient in common. I would appreciate your collaboration. And here's justification for the lab work that I would like requested. And I found that if you do it in a way of respect and do it in a way of collaboration, 99% of the time they are delighted and they are thrilled.
I personally refer, as a dietitian, I refer to a lot of health coaches. And I also, interestingly, also get referrals from health coaches. And I joke that's interestingly, like if you are referring to someone, it is a symbiotic relationship. And one of the things that's really, I think, been very helpful is in my dietetic training, and everybody has different training. Of course, there are the tenets of the training. I focused a lot on both the science and then also on the assessment, obviously what nets me out in my current business, but on the assessment of someone's total nutrition. So I want to look at, before I say, hey, like you're dealing with stress, I think maybe we should, and maybe your anxiety is keeping you from sleeping, I should give you a magnesium supplement. What I actually do is turn around and say, like, so are you eating these foods that are rich in magnesium? Are you, taking these supplements? But also what's going on from a calcium standpoint? And then when I put together a plan, then I collaborate with the health coach on the implementation of that plan. Have you, I'm curious on, as we're talking about, I feel like we can break down a wall. That seems to me like you're the greatest person that can help take my client. It's the same way I work with my personal, the fitness professionals that are working with my patients as well. Does that seem for dietitians that are out there? Does that seem like a good system, or is there a way that you think health coaches and dietitians could work better together?
I do think it's a good system because I am a big fan of referral partners. And like I was saying, I will say to clients, perhaps we may not be a good fit, but I would love to refer you to somebody, because after working with people for many years, you get somewhat skilled and your intuition tells you this person may not be the right fit for me, but bless them for reaching out. And, it's hard for people to ask for help. So if somebody asks for help, I want to do my best to say, you know what, you've told me a lot about you, and I can say that from what you've shared, I think you may appreciate working with a dietitian because your father was a doctor and you might have more validity to, right, somebody who's a dietitian versus maybe you have an impression of a health coach that is other than what it is. Or do you know what I mean? And just trying to meet them where they're at and find the right fit. Like I said, I know all the people who are supposed to work with me and my staff find their way to us. It's fine. And I'm a big fan of referring people, and I love collaboration because what we do is we work as a team. So I do all of the initial intake, and it's quite comprehensive. I want to know everything about them. We have a very detailed intake form. We ask for several years of lab work because I want to see how you're trending. I want to look for, if your calcium is 9.8 and it goes to 9.4, but then a week, later it dropped to 5.9 and you were fainting. Oh, well, I think I have a good reason why. Do you know what I mean? There's things that we can look at. So we already collaborate that way, and we find that it works best because you know what? Sometimes it's great to brainstorm. I was just away a couple of days ago with a couple of colleagues, and we were doing that very thing. We were just collaborating and brainstorming, and it's wonderful. So, like I said, we can definitely reach out to a health coach, reach out to a dietitian, anybody who's listening. If you know someone, it takes a friend to be a friend, so just reach out and make friends with your dietitians because there's more than enough of us who are trying. We all have the same objective. We do all the work together.
And that was also, too, for my dietitians in the audience, who I have so much respect for. Many of them are, have come onto and done interviews. And it's like, you have your area of specialty and you have these great resources like the health coach. And you do the intakes, but then you also have a whole staff of other coaches, right, that you have that can work with people. And I just feel it's that whole notion of helping somebody find the person who's going to speak and act in the way that activates them, like what lights them up, right? And so, love that part. Okay, we've done that part. I want to move on because another piece that really attracted me to your work is your focus, and it makes a lot of sense when you think about intuition, is how do we connect to our intuition? So, these days, like, I just hate the B word, but I'll just go with it. We're busy and we're busy of our own making, or we feel like we're busy and, and scurried. But I think this concept of meditation has also, unfortunately, become something. It's like yoga. Like people are like, I either do it or I don't do it. I can't meditate. I don't do this. And I think that notion of being able to calm things and stop your thoughts and have a moment as well as to harness your intuition is just so powerful. So how do you incorporate meditation into your health coaching?
Any way possible and every way possible. Every way, because one size doesn't fit all. It's like shoes. There's plenty of meditations. There's plenty of different shoes. If shoes are your thing, or insert whatever article of clothing or thing is your thing. But I have found too, and we were talking about this a little bit too, but with people who are unaccustomed to meditating, it is a wonderful thing to start them out on a guided meditation because the B word, everybody's busy and they say, I can't quiet my thoughts. I can't do it. Or it feels too esoteric. It feels too out there for them. But a 1-minute meditation, a 2-minute meditation, a meditation before sleep, a meditation when you wake up, any and every way. And I am tenacious. I won't give up on it. Because it matters. And I will say with busy professionals, with musicians, with athletes, I have said to them a 1-minute meditation when you go into the restroom, go into the stall. I've recorded it on people's phones for them. I shared with you on my website, there's a recording of the Melt Away meditation. But I've recorded it for them and say to them, listen, for 1 minute, if you can just calm your central nervous system, and then we kind of build on it, just building on it. But I'll take the victory of just 1 minute out of that 24 hours, because at that point, if I've inspired them to be able to at least do it the one time, yeah, then we have a finger hold in and we can kind of move in and get them meditating, because it matters. It really significantly helps.
So I have a couple of audience questions that came in, and I hear you guys, I see you guys, it's going to happen, but I get to ask mine first. So my first question is, and I learned so much from other experts, and in this space of performers, so you work with, as we were talking about it, performers, musicians, athletes, executives, etc. But we're all performers in our daily lives. And one of the things that I think we focus so much on how nutrition can help us perform better. But in this era, especially like the other night, I'm a massive basketball fan. So it was like crushing injuries, like career-ending injuries, right? But also just, so what I think needs more focus is the recovery. So the 1 minute meditation you were talking about, phenomenal. But I'd love to get from you some of your like quick tips on what do you have people do to post-performance, like reset your system.
Okay. I'm so glad you asked, because I literally was having this conversation with a client today, because she was talking about THC and CBD and all of those products. And, and there is a whole industry of people who are exploring that, which is wonderful. If that's their thing, that's great. But I'm finding that athletes are very receptive to the benefits of that, because it's full body, right? And there's some targeted applications that people can do to say post-tournament. They can go ahead and they can, I'm going to tie this together, because an Epsom salt bath is one of the best things, right? And I love that, because you're shaking your head like, yes, same girl, same, because that's what we do.
Yep.
So there's some common ground there. Exactly. But there's a new product out that is CBD, Epsom salt, which is more of a full body kind of relaxation. So explore, figure out things like that. But the three biggest things, and I did write this down, kind of anticipating, my intuition told me that I was going to anticipate a question like this, because it really is about engaging the full body relaxation. If it's just go and be quiet or just de-stress, sit in nature. I love a nature bath or an Epsom salt bath. Hydrating, making sure that you're really hydrating your cells. And then just really making sure that they sleep. I find that a lot of musicians and a lot of athletes, they're not getting, jetted around on luxury planes and all of this wonderful thing. They're in cars, they're on trains, they are rushing to catch different modes of transportation. They're not drinking enough, they're not hydrating enough, they're not sleeping enough. And those are the biggest things, just to be able to say, okay, you've asked your body to do something that was quite challenging, but you really need to sleep. You need to rest. And I'm a big proponent of sleep too.
I love that. I've worked with, back in my Hollywood days, I worked with a lot of comedians, but also more recently with a number of chefs. And I think what we're hitting on in this space is when you're exposed to a lot, like a high intensity of environmental stimulants, like right around at that time period, we say like, don't try not to have your mobile device right by your bed. But imagine if you literally are a rock star and you just left the stage, or you just left a game, and, think about how we feel as a viewer when we've left something like that. So I think what you're saying about that, taking that and being able to get that sleep, I'm also very excited about CBD. We have a CBD guide that we worked with several experts so that you can have that. You need to know what's the right CBD for you, and especially if you're an athlete, to what to avoid. But love that part. Okay, so some of the questions that came in. So one question, I literally got a full page ad, not an ad, but a full page written to me in direct messenger saying, can you please ask about this? And, again, I think maybe the people that are on my page were just like, it's exciting to have a dietitian and a health coach engage in this conversation. But what she said was she went to a health coach, it seemed like, I might be adding something in here, I'm trying to shorten it, but everything seemed great about the health coaching experience, like understood, have a plan, taking supplements, doing well, and felt well, and everything was going well. I'm going to make this dramatic, but it suffices. I think I'm doing her justice. But then she said she went to her doctor, and her doctor told her she had to go off of all of the supplements, and he wanted to put her on a medication. And she's really, like, it's upsetting, it's stressful. As you were talking about, like, there's that whole, like, my intuition and that piece. So her question was, how do I, like, I got the sense nervous, I'm inserting that, but her direct question was, what do I do now? Like, how do I move forward? I have my own biases, but I'm going to open the door to you and leave that one there. Yeah.
Perfect. Okay. Well, I'll pick up on it, and then you jump in with whatever. Let me just make sure I'm understanding you correctly. This is the person who is saying, I was working with a health coach, and I was doing all these things, and everything was good, but my doctor jumped in and said, please stop doing it, and I want to put you on a medication.
Yes.
Okay. Cool.
Yeah.
Well, the theme of our interview here really is intuition. And I would absolutely encourage that person to, make a decision that feels like the right decision for them. I encourage people to use their brain. Do not be bullied by a health coach or a doctor or a family member or a neighbor or anybody else. You meditate and think about what feels right and do your due diligence. Really evaluate and say, do I feel better? Is this, can I actually demonstrate by saying I started working, I feel better, I'm taking this, I'm taking that. And then be willing to say, okay, perhaps I might decide to come off of everything, but then I'm going to give myself a little bit of space to see what the impact is of coming off those things. And then if I don't notice a difference, perhaps I think I want to go ahead and I want to take this med and maybe take it for a stated amount of time, but do your homework. Mm-hmm. There is nothing more important than you figuring out what's right for your body, because, I'm sure the doctor is a wonderful person, a caring practitioner who is trying to do their best within their scope of practice and give you some really good guidance, right? If you have triglycerides of 495 and they say, you really need to do this, perhaps it's reasonable to say, you know what, I'll go on a medication. I'm not anti-medication at all. I'm so happy that in 2019 we have meds. I think people miss the boat when they just go on them forever. But use what you can if it's going to get you the results that you seek, because there are some things that you really need to consider. Like I said, it's very open-ended, but I think that this person really has to consider what feels like the right choice for them, and also prioritize what you want to get out of it. Mm-hmm. Is the doctor trying to encourage you to do something that is not your priority? Do you know what I mean? Mm-hmm. What is your priority? If you can't sleep well and that is your number one priority, do everything you can to try to improve your sleep. And your intuition will tell you what that is.
I love it. I mean, I wholeheartedly agree with you. And I think I might have been a little bit more aggressive right at the front. So I'm glad that you probably softened me, because I'm like, well, fire that doctor. But the reason I say fire that doctor is if you don't have a good relationship where you can have this conversation. So what I will say to this person right now is you have to be in charge of having this conversation. Now, one of the things actually that Dainna brought up before, though, is I think a strategic tool that might be missing here, which is you could ask your health coach to write a letter and or have a conversation with your doctor on your behalf, because there's a very good likelihood that your doctor doesn't understand the protocol that you're on, or maybe even the path or the roadmap, or where I've had that experience as a dietitian where I remember a doctor calling me and he's like, you took my obese patient off of diet soda? And I was like, yes, because it was a consult for bariatric surgery. Like, they're not going to be able to have it, and the sooner I get them off it, we're going to be, So you have to explain some of those things, because we're coming at it from different places. But if your doctor is not open to the conversation and also open to explaining to you why you need to be on a medication or why they're recommending a medication, So I think what we're saying here is this whole healthcare world, you really are at the center of it, and you have to either connect the practitioners together, and I thought your example, Dainna, in the beginning of saying like how you professionally write a note and communicate, let your practitioners duke it out and then come back to you and empower them to do that, I think could be really valuable.
I love that. Can I add one thing to that too?
Please do.
I have absolutely given the advice that you just shared, and I think it's such sound advice. It does not land that well with everyone, and that's okay too. But I am a big fan of encouraging people to be brave. Do something that may feel a little bit out of your comfort zone, because what will likely happen is this. You will be brave, and you will push back with your doctor about their recommendation. And some people say, oh no, I have a wonderful relationship with my doctor, but it is not wonderful the way they think it is. It is one way wonderful. And to me, that is not a collaboration.
Right.
So they eventually move on, and that's okay. But I like I said, I like for people to be brave, and I like for them to do something that perhaps galvanizes their ability to see, no, this person is not serving me, and I can just let them go and bless them and think wonderful things about them, but there's another doctor out there that's going to be a better fit.
Great. Love it, and you're absolutely right. Like, I think it's so fun to basically say, like, you have to, again, you're the steward of the ship, and it's how do people work for you, on that part. Okay, so the other question, I'm lopping like 4 questions into one, and it's basically about what is the best diet. So I got a question about keto, I got a question about paleo, I got all of these, and so let's put it together. What diet do you recommend and why?
There's no one best diet. The best diet is the one that's the best one for you. So, when we meet in person, we'll have lunch. You'll order something different than what I'll order. There is no one diet that's best for every human, but every human can figure out their best diet, and it's completely personalized. And that's awesome. That's fantastic. That's great. I mean, we learn so much about the world, and we learn so much about things that are happening in the world. Take some time, work with a dietitian, work with a health coach, figure out your best food. It's really worth it. Spend a year out of your 100 years on the planet, figure it out. You'll be really glad that you. So yeah, no one diet.
I love that.
No, yeah.
Totally. And I know we already touched on the CBD, THC thing. I got another question. Again, you guys, I'm summarizing because I promised I would make this a 30-minute, but I could talk to Dainna for like 5 hours. So we'll have her back, or we'll do a podcast over lunch or something, so you can see what foods we're choosing. But I did get asked the question about supplements. Are there any supplements that you think are essentials or go-tos, or you're really focused on making sure that people connect with?
Yes. The essentials, and everybody, I can feel you waving your head already. Magnesium, right? We are so depleted in magnesium, but I actually like to have people get their levels checked. Call me crazy. I like to see, because I don't want people to spend money. I tell them it's going to be a part-time job when we are actively trying to reverse something. But we can do it. But you're going to have to be very attentive to your food, to your activity level, to your supplements. And believe me, you're going to feel like managing your supplements is a part-time job. But on the other side of it, when we reverse this autoimmune dynamic, when we get rid of your asthma, when we reverse diabetes, then you're going to be left with a handful of supplements. And the handful of supplements are 9 times out of 10, they are magnesium, a really good high-quality fish oil, a B complex, vitamin D if you live in the Northern Hemisphere from October through April, and perhaps some other type of, I like the 5th one to be sort of a flexi spot where if you are a postmenopausal woman, you may need some sort of HPA adaptogen, right? Something like that. Or if you are prone to colds, maybe some sort of a vitamin C, right? Zinc is a really big one too, and if I could just have those core 5, but like I said, I like to be flexible with that, and I really don't believe in people wasting money going ahead and taking supplements all the time just because it's what you always do. Take them with intention, but then test and see, because you 9 times out of 10 you can reduce your levels to a maintenance level, which is good. And people get encouraged to say, okay, I know, and B vitamins, hands down, B vitamins are really important. But people get encouraged and they realize that they can get a lot from, oh, I don't have to take selenium to help my thyroid. I can eat Brazil nuts. That's so great. I'm a big fan of food, and people, and I will always, 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 always say, let's look for a food source. You know what? Tahini is a really good source of calcium. So let's do that. Or, let's go ahead and have you take some cantaloupe because you need more vitamin A. All good things like that.
Oh, I love it. And you're such a promo for better nutrition assessment tools. I got to get you involved in that part. I mean, I think the key thing that we're saying is what you want to do before you decide on any one thing is figure out who you are. And you started off with that. It's about your intuition, but also about information about your physical body as well. So, Dainna, this is such a pleasure. The whole time you've been speaking, we've had 5x5 Health up on the screen. So I meant to tell you that before, but your website's been up there and we've got everyone. As we start to get this out to people, I'm just thrilled. If you guys liked what if you liked what you heard today, and if you learned something, especially if you're watching us on YouTube, give us that thumbs up or give us a like over on Facebook. And most importantly, these Better Nutrition Expert interviews, they're a nonprofit project. The only reason that we're devoting an hour of our time tonight is to help you connect with this information and also to help others. So if you know somebody who would benefit from this information, a practitioner, maybe this is the way you want to tell your doctor about why you want to work with a health coach. Share this video with him or her, and that may help move things along. And again, thank you so much for joining us. And Dainna, just a pleasure. I'm thrilled that we've connected.
Thank you so much, Ashley. Yeah, this was real fun. I'll see you soon.
Okay,
Thank you.
Perfect.
Bye-bye.